Born Before 64 is a TV show that asks the vital question, what will we do for the rest of our lives? Kathryn Raaker hosts a show for baby boomers and above, inviting real people to tell real stories about overcoming issues, about facing with courage and triumph the significant obstacles many of us face every day. So let's join Kathryn Raaker for Born Before 64.
Good evening, everyone. This is Kathryn Raaker of Born Before 64, and our show is really an exciting show tonight. We have some exciting guests with us, and I can't wait to introduce them. I have sitting on my left Dr. Mark Mandell-Brown of the Mandell-Brown Surgery Center, correct?
Correct.
I got it right. And you are triple board certified?
Yes.
Right? And I want to introduce also our friend Marty Schultes, who comes and does a lot of different things with us from time to time. And she was very interested in meeting you. And we brought an audience tonight as well, Born Before 64s that really want to know what can be done, you know, with their appearance, or they want to change something, or they want advice. And you've been in practice for how long, Doc?
I have been in practice longer than I'd like to admit, but about 30 years here in Cincinnati.
Well, you don't look it at all.
Northern Kentucky.
You look like you're in your 40s.
Yeah.
Does that help?
And I just celebrated my 60th birthday.
Well, I'm older than you. I'm 69.
I'm catching up, but you look great.
Oh, thank you. Thank you. And, you know, I have had the pleasure of having a procedure done. We're going to be doing our third one, which is, you want to talk about it for a minute?
Sure. One of the things that Born Before 64, people really want little downtime, and they want not too invasive, which means they really don't want the S word or surgery. So we have lots of different things in 2014 to help people. Number one would be the Botox and some of the fillers that we'll show you later.
Okay.
But the other is something called radio frequency. And so for the audience, radio frequency or RF waves, you think of microwaves, radio frequency waves, laser waves, but radio frequency heats the skin and the collagen, and it melts fat, tightens the skin without surgery. So with 5 or 6 treatments, each about a half hour, you can tighten the skin on your neck. You can help some of the pouching in our abdomen or in our flanks. And as we like to say, lose the handles, but not the love.
Okay, that's cute. I know. So, Marty, I know you've had a couple questions that you would like to ask the doctor.
I do. Well, you know, I'm one of those, where do you start? I want to start. But that's interesting about the radio frequencies, because you would say that and I'd be like, radio waves, right, that, you know.
And what's it doing? And actually, as you may say, Kathryn, that it's like a hot stone massage, but it's a rapidly moving device that has 2 components. It has the heat component, and it also has some electromagnetic component that promotes healing. So in this avenue of non-surgery devices, we have cool sculpting, where you freeze the fat cells to melt them, or you have the radio frequency, and you also have ultrasound. Now, we've looked at all these different devices, and we happen at our office at the Mandell-Brown Plastic Surgery Center, we really are hot on the radio frequency, and it just works great. The cool sculpting, we've had cold enough weather recently, and anybody who wants to put more cold on themselves, it's like, why freeze when you're freezing outside? So we like the hot radio frequency, and ours is called the Venus Legacy.
Right. And actually, it was really funny because the reason I met the doctor was they had, a publicist had called me and told me about it, and I had heard about the first generation, which was called something Excalibur or something like that.
Well, the very first generation, now this goes back about maybe 5 or 10 years. I don't know if anybody in the audience recalls Thermage. But there was something
Right.
called thermage, which was also the first generation radio frequency, and it was FDA approved for the crow's feet around the eyes. But these newer devices actually are approved for the other areas to be treated.
Right. And they can even get rid of the cellulite, a little bit of the cellulite,
They can
right?
help stretch marks and cellulite,
Right.
But primarily fat and reshaping in the abdomen, the thighs, face, chest.
Right.
So it's got a lot of application.
So what's the downtime from this, and what happens with, when you lose that? Then is the body just reabsorbing that, and
Right.
will it come back quicker? What's the effects then later on from that? Once you do a treatment.
Right, and so you really need to do a package of 5 or 6 treatments. The fat cells really do get resorbed. Just like when we do liposuction, traditional liposuction, we're actually doing a procedure to remove the fat cells. This helps absorb the fat cells by that high heat energy.
Okay, does it almost like it smooths it down or something as you're doing that?
Yeah, if you would really look at the microscope, underneath our skin we have collagen.
Okay,
And so it's the collagen that gets tightened.
right. Can it also help underneath the dark circle thing?
It can a little bit.
A little bit, but not much.
No, we have other things, and one of the nice things is that we have what we call multimodality, which means we have lots of different techniques available. So for some people it may be the non-surgical venous sculpting. For other people we may need just a little Botox, or maybe a very mild facial, or maybe a little bit stronger peel. Or if it's a crow's feet around your eyes, we may actually need a stronger laser. And then I don't want to mention the S word, but there's always surgery as another resort.
Right, for people that really would like to give
Right,
it.
so if you have
Right.
bags under your eyes that you want to remove, sometimes you can't melt that with a venous legacy or the other device. You have to have surgery. If you have excess skin here on the upper eyelid, probably you need surgery. But what the public doesn't really realize, most people don't realize how easy those procedures are, and with little downtime.
What's little downtime? Tell us what little downtime
If
is.
you give us 3 days,
3 days.
we can get you back to work in 3 or 4 days. We have a, just to put a plug in for Cincinnati Magazine, but on the inside cover this month is the restaurant guide, the top restaurants in the city. And the top 10 restaurants are really not what you expect. It's not the typical Orchids and the Jean Robert restaurants, so that's kind of an interesting issue. But on the inside cover, we have a patient who, on the morning of her surgery, she said, "Dr. Mandell-Brown, I forgot to tell you, but I have a very important dinner party in 4 days in Nashville. And I'm going to be with Elton John's drummer. I'm going to be having dinner with Sting's producer and a couple other VIPs in the Nashville scene."
Wow.
So I said, "Oh." Well, usually we say a week to 10 days of downtime for a facelift, for somebody in the public eye. So if we do surgery, say on a Friday, and you give me the weekend, 5 days, and the next weekend to recuperate, by that next Monday you should be fine. So that's about.
How did she do?
Well, so we did the facelift, and again, we're meticulous with everything we do. And a couple key things that the patient and your public can do is, 1, avoid aspirin 2 weeks before surgery. 2 is avoid vitamin E or fish oil before surgery. All those affect your platelets, your clotting factors, and we want your clotting working well. So if you have a patient who's had a heart attack or heart illness, they're taking aspirin. Why? That thins the blood. So, but we don't want thin blood. We want people that will form clots and platelet working. So 4 days later, she was down at the party, and thank goodness nobody could tell that she had a facelift.
And on that note, we have to take a short break. Can you give your website out, please?
Sure, it's www.mandell, MANDELLBROWN.com.
And we'll be right back with Dr. Mandell-Brown and Marty Schultes and our audience, who we'll be hearing from after the break. We'll be right back.